All right, I think we are online, but as usual, never trusting of the modern technology, I want to make sure that the broadcast is actually up, so let me just double check. I have news, significant news, and something pretty cool to show you guys. Give me one more second here to make sure that we're up and running. And I'm pretty sure we are, but again, I just don't trust. I've had a lot of problems getting this OBS to work consistently. Sure. Yep, we have sound. We're good. All right. As you guys know, I've had a rough run with this rheumatoid diagnosis that I've had now for the last about 7 years, 6 or 7 years, and in my opinion, I have ankylosing spondylitis. Both autoimmune, both inflammatory conditions, immune system overactive, attacking yourself type scenarios. But for me, the manifestation has been 95% back pain. And I don't mean like you lifted something too heavy and your back hurts, but just intense, unbelievably bad pain that changes location, sometimes even the same day. The only good news I've got is if my lower back's hurting, my middle back usually isn't. That's been the case for me now for pretty much the entire time I've had this, but unfortunately, that changed here a few months ago, and I think it probably tied into when I fell. I had a real bad slip on my pool deck. I have an area that's wood, and then you've got about 6 feet of wood, which the planks went lengthwise in the way I was traveling, and then it transitions to concrete. So I went sliding across the wood. It had just started raining. I went sliding across the wood, slid onto the concrete several feet, and then lost my balance, and then fell right on my tailbone pretty much. And I thought I broke something. I've not been right since then, unfortunately. I'm 200 pounds. Actually, at that time I was 209. I'm 191 right now. But 209 pounds falling on the lower part of your back where you've been hurting for years anyway is not a very good plan. In any case, we have been fighting this now in many ways and just trying to figure out what in the heck is going on with my condition. I get some pains in some of my fingers, which is the only RA type problem that I have. I'll get a finger joint that's hurting here or there, but really outside of that, it's everything else I'm dealing with points to ankylosing spondylitis. Now, a quick rant about my doctors, and then I'm going to get into my CT scan, and I've got imagery of it that'll definitely be bringing up for you guys here shortly. I was hoping maybe, it's a live feed, maybe somebody will show up. I know my live feeds have been very boring and very long as I've talked about this condition, but in any case, wait around a few more minutes here before I go and put this on the screen. Um, so I have costochondritis, which is like your ribs, your sternum, the breastbone, and all the way around to the back hurts intensely. Um, my costochondritis is not exactly textbook though, because I believe in most cases, inhaling and exhaling, which is going to work I think they're called sacroiliac joints, but maybe I'm wrong. Um, but anyway, the rib joints, the soft part of your rib joints where the different parts come together. When you're inhaling, you're pulling and stretching on that, and for some people it becomes nearly impossible to breathe. It hurts so much. I, on the other hand, don't really notice much difference when I inhale and exhale. They just hurt like hell. And there's places I can just push in between the ribs up here near those joints where they kind of come together and hit the breastbone. And I can have intense pain by just pushing on those different areas. Um, But anyway, it kind of started when I got on biologics a few years ago at the rheumatologist. I got on Simponi and immediately had pain, very painful costochondritis. Now, this is not the first time I had it, but it came and it stayed for about a week and a half. I had a second follow. The initial follow-up dose was 2 weeks, so I went back in for that. I told them, I don't know, I think they had a little quick appointment beforehand. I said, I don't know, I got really bad, like costochondritis the whole time. And they said, don't worry about it. So I got it. The next dose was 30 days later. For 21 days, I had severe costochondritis. And I told them again, I don't know about this. I think that, no, don't worry about that. Just stick with it. So I get that dose. I've had costochondritis ever since. More than I've not had it. Maybe I went a week without it, then I went 2 weeks with it. I refused to take any more of Simponi. They switched me to a different one. I took a couple of doses of it. I had no relief. It didn't get worse, but I had no relief to the costochondritis, no other relief. And I know it's supposed to take a while. You're supposed to be on this $14,000 a month IV. I also kept asking them, please, let me just get the little self-injector, I can go home and every month I can take the damn thing out of the fridge and push the button. And they insisted that, no, I need to come in for the IV. So I got really pissed off and I quit going to the rheumatologist. So that's been a couple of years ago now. And I was on steroids for about a year. And I finally just decided, you know what? I'm going to get off this. I don't want to be on steroids. I weaned myself off of them. Of course, the costro and the back pain worsened, but I don't care. At this point, it is what it is. So, fast forward to January, I decided to go after this really big time. I might have mentioned in my last video, I was adding supplements and vitamins. So I was taking a pretty clean set of vitamins, vitamin D, vitamin K, vitamin C. Can't remember if I did I don't think I did a B. But in any case, I also added magnesium, and I added iron and a potassium, and I think I also did a zinc. Now, I mainly added the potassium and the iron for a couple of reasons, to kind of round out the I guess you'd say minerals, to try to stop having an imbalance, and also for a couple other reasons I added in the zinc. And the iron is because I have thalassemia trait. So I have small red blood cells, so therefore I have more than a normal person, and it puts a higher load on my system to make those additional cells, so my iron demand is higher. Additionally, taking zinc is one item that reduces your uptake of iron. And I don't know, there's been a lot of things going on. This was back in January when I kind of put all this together. So I got on this anti-inflammatory. I started taking curcumin, ginger root, and one other supplement. I can't remember what it was. And I had no problems, man. Like I started taking those pretty quickly, one after another. I took, a couple of things for a few days and then ramped up pretty quickly. No problems, no stomach issues or anything that I expected. And then one day I was walking around and I had a visual migraine. There's several words that describe it, but that's one of them. It's where your vision basically starts getting zigzag lines in it and it splits apart and you get like this area that's just black, and then your peripheral vision goes away. It's quite frightening the first time you do it. But long story short, I'd had one before and I knew that it was either electrolyte imbalance or low blood sugar in my case. So immediately had some Coke, which I never have. Seemed to get it under control after about 20 minutes. I had another one the next day, and then that was it. So at the same time, I decided I'm going to stop taking these, the things like curcumin and whatever those three kind of like health food store supplements that you can take that are anti-inflammatory. I cut those out. I got back home and I had another episode of dizziness and some other symptoms, but not to the point of visual migraine, but I felt really bad. So I went and bought a blood sugar monitor, found my blood sugar was right at the very bottom of it was 1 point above what would be called low blood sugar. So I decided to start having some sugar every day for a few days. So I had a little bit of sugar each day. Got myself feeling a little bit better, 60% better, 70%. I just didn't feel right. And I started getting, about a week or so later, started getting a lot of chest pressure and chest pain even, that I couldn't quite tell if it was the Costro, but I felt like I was having pressure of the chest, like as in cardiac. So I checked myself into the ER. They admitted me after finding absolutely nothing wrong. They they put me on an IV, gave me some, just some saline solution, um, and I felt like crap. But they couldn't get me a room. They kept me in the ER. I was in this little narrow bed, and I just decided to walk out. There was no point in me staying. Uh, but they did do several tests on me. They looked at the cardiac enzyme to make sure I had no heart damage. Of course, they did blood pressure monitoring and heart rate monitoring and chest X-ray, and everything was golden. And I'm like, why am I? What's the point of staying other than you guys cashing in for, what it's going to cost me on copays? So I left, but I stayed on top of this. I decided to try to do a follow-up with a cardiologist. I did a follow-up with one of my primary providers, and she got worried about my cholesterol level. She's very big in the diet and not super concerned about cholesterol like a traditional doctor, but even she was like, yeah, your cholesterol is very high, and I would recommend that if you don't want to do a statin, at least do something like Zetia. Um, and I want to say that at this point I had already done this. I don't remember the exact order. I think I might have already been on Zetia and berberine, which is I think it's an extract of some kind of root that is really good at reducing cholesterol and also your blood sugar, which I don't, maybe actually, again, I don't know the timing, but it does reduce blood sugar a bit, or at least it reduces, I don't remember the exact mechanisms of all those, but that may have contributed. I don't think I was on the berberine at that point. I think I got on it after Zetia. I might have been on. Anyway, I went to a bluegrass event and I left 3 days early because I felt so bad after all that. Just felt like I was on the verge of dying pretty much. And I had a total cholesterol particle size count and all that done, which actually turned out to be pretty good. I was 73% good LDL, like the bigger ones or whatever, the good ones of LDL. So I was only 20 something percent of my LDL was the bad kind. HDL could have been better, but I'm not very active, of course. So, what do you do? Anyway, I decided after I left that event, I might be getting out of order a little bit. Maybe I left the event and went to the hospital. I think that's what I did. Yeah, so I was on the berberine. I was on the Zetia at this point. And they mentioned nothing, by the way, about this stuff. They had my whole list. I gave them an exact list of what I was taking. They didn't talk about any of that, possible problems, whatever, that side effects or anything that might contribute to it. No, we need more testing. So I decided, you know what? I'm out. I'm just done. So I went cold turkey. I'm not taking anything anymore. I'm done with it. Let me see how I feel. Within 2 days, I was feeling a lot better, like 95% better. I spent 2 days caulking and painting doorways, windows, and different things on my house that needed to be taken care of. I felt a lot better, and I'm going to tell you that I felt perfectly fine since cutting all that stuff out. So, likely berberine or Zetia, one of those two prescriptions. Berberine's not a prescription, but Zetia is. Also, I got pretty scared at one point and decided I would try dabbling with statins for a couple of days, and I took a very tiny dose It gave me a headache from the first one until the last one. I had a headache the whole time. I did it for about 5 days, and I said, you know what? I'm done with that. I just don't remember how that. I think that was after the hospital is when I decided to do that because I was worried about the way I was feeling until I got into a doctor. So I want to get a CAC score, and I scheduled one, but it was over a month out. It was the fastest I can get it. $200 here locally. Have to go in on a Saturday and do it. And we had a trip down to plan to watch the Artemis. And by the way, we finally got to see Artemis go up. We got to see Artemis 2 launch, and it was pretty cool. Maybe a little bit underwhelming compared to what I was expecting from the space shuttle engines. I did get that very classic space shuttle kind of sound that it makes, like a popping type sound. Is a little different than the other rockets. But it lasted, in Titusville, it lasted about 10 seconds, and then that was gone. It was back to pretty much a traditional Falcon launch type deal. We did hear it for a long ways, which is kind of neat. Very impressive, though. Watching the flames lapping the ground when the rocket had cleared the tower was amazing. Knowing the elevation of that tower is quite impressive. So, 400 plus foot flames, really something to see. We were 12 miles away in downtown Titusville. But since we were going down there, I knew that I could probably get the scan faster. So I found a company called Life Imaging, and they actually do the scan free. However, you have to fall into certain groups. Some of those requirements are, I'm going to bring up this real quick while we're talking, if I can get this to work. That was Artemis launch. So as you can see, if you look at the distance from the bottom of the rocket to the top of those towers, the flames were closer to the ground than that. So it was really neat how long that flame is. And Starship's even better. But in any case, I got the scan free at Life Imaging, and I knew that when you go there, they're going to sit you down and they're going to kind of give you a sales pitch on their full body scans. I had some interest in it before I went there, so I had no problem listening to it. So we go in there. The first thing they do is ask Melissa, "Did you sign up?" She said, "No." "Well, do you want one for free?" And she says, "Not really." And I said, "Well, just get it, She scores 0 all the way across the board. I scored 18. Not terrible, but 0 is by far the preferred score to get on a calcium scan. And the fact of the matter is that actually my score is, they give you the calcium score for your heart. They don't give you the calcium score for your aorta, your other main arteries. So unfortunately, what that means is it doesn't mean you don't have any calcium buildup. And by the way, this is hardened. I'll show you some of the images here. This is hardened plaque, meaning that first you would have had soft plaque. And hardened plaque, they make you put your arms up, by the way. The hardened plaque means that you had soft plaque that has basically healed, if you will, and has hardened, is stabilized. What you don't get with this score is what your actual current plaque level is as far as soft plaque, the kind of plaque that will kill you. But I've been learning to use this software, so literally you can just slice yourself open and reveal things like your lungs and all the little airways and stuff in your lungs and your heart, and you can go in and just see all kinds of amazing things. Unfortunately, that includes seeing hardened plaque that's built up inside of your body, which is not my favorite thing to see, to be honest with you, because it kind of like it makes you think, hey, I've got a problem here. So I'm going to show you guys. By the way, I was 0 on everything except for the one artery in your heart that matters, which is the what do they call that one? CAD or CAN? It's the main one. It's where your widowmaker would happen at. It's also the first one that's going to get deposits. So if we look at this view of my heart, at that kind of purple V, if you look at that purple line at the top and it goes across kind of a wide area there in the center, that is your aorta. That makes a big U-turn in your body. So it comes out of the top of your heart and turns and goes down your spine, basically. But look towards the middle of the scene here, of the overall heart there. You see like kind of a round, and there's like a space. And right there where that space is at is real close to where, you see that little bright spot right there that pops up right there? That is hardened plaque. That is in my main, in the most important artery. If that blocks for some reason, that's your widowmaker. That's where you die. Now, the good news is that it's a very, very, very small amount. So I guess, you can say, well, at least there's that. I scored an 18. People go in there and score 400, 300, 150. So 18 is great. However, not to be confused with the fact that you could score an 18 today and a 50 tomorrow. I mean, it's not exactly. We're going to come in, we're going to slice this from another angle. So right now, right where that little bright area is like think of the corner of a door. It's just a hard edge. And I'll show you. See how we're slicing that off right there. So this, by the way, is not the correct view to see this. I'm just doing it this way because I've already got the software set up. But in any case, if you see it on the correct view, it's a little more frightening, to be honest with you, because it contrasts more. But the reason for this video is that I got this imagery from them. By the way, the full body scan is about $1,500. So I got this imagery from them, and they give you a USB drive. I downloaded 3D Slicer, and I started learning how to use the software because I want to know why in the hell I hurt all the time. Why do I hurt all the time in my back? So you've got your spine here, and by the way, they give you a report as well, and my report was pretty clean. I mean, it was like, oh, mild degenerative disease in the spine, like aging related. I have a kidney stone, a small kidney stone, like 1 millimeter, I didn't know about. And my spleen is slightly enlarged, which is not good, but also not uncommon with autoimmune. So when I finally started figuring out how to do all the things with this software, I wanted to look at my spine. So let me figure out the right one here. So I figured out how I could trim back as I was showing you earlier, I can start just cutting out things in front. So we're going to just slice off my breastbone and my ribs. Now, if you are sharp-eyed and know a few things medically, you already see a major problem. But what I saw was this first. I thought, what in the heck is this protrusion? And it sticks out, it's several millimeters. And I first saw this. I didn't really pay attention to anything else, but in any case, this is a bridge. So in other words, these two vertebrae are bridged. They are fused together in the front, and actually over here too a little bit, but mostly on this side. And so I kind of looked at that for a couple of days, ran it through Grok, got a name for it, and was kind of like a little bit freaked out there about it. But I thought, well, it says that if you have traumatic injury or repeated problems in an area, your body will fuse these together like this to basically, like stabilize it. So this is exactly where my pain is at. I get pain in my back off of this rib and the ones below it, and through the front rib as well in the same area, the lower front rib. So if we undo the slicing here, I'll get pain very much just kind of in front of that. So Anyway, then I go back because I'm really trying to figure out what's going on. And I realize I've got some serious problems going on. Look at my spine. Let me get this rolled a little bit. Look at the rest of my spine. So if you look at my lower spine, pretty normal. You see your segments and things like that. And you go up and all of a sudden you realize that these are like, looks like melted candle wax. These are all fused. So there's no flex in my spine at all from that one there all the way up until you get into my neck area. And I don't really have good visibility on those to know how bad my neck area is. But I can tell you that for some time I've had problems looking up for quite a few years now. And yeah, this is not good. By the way, you see that floating, looks like a bone floating just to the right of the spine there, about halfway down? That is actually a calcium deposit. That's a calcium area of my aorta, right at the top of the U-turn. And that's pretty scary, huh? But in any case, that's a really big area of the aorta, so it's not like a blockage. It's not even uncommon. And there's actually others in my aorta further down, which is also pretty normal for somebody in my age range. But obviously it's not great. And by the way, both conditions that cause this to happen to your spine make calcium deposits a big factor in your heart, in your whole, you're much more likely to have calcium deposits. In other words, if you have one of the two conditions, that can make your spine do this. So what can make your spine do this? Well, initially I thought dish. It's dish syndrome, but the proper, I'm going to try to tell you these words. Diffuse idiopathic skeletal hyperostosis, dish disease, or another word for it is called somebody's name disease. The thing is that a lot of people, about 1/3 of you, will get dish if you live long enough. Once you get in your 70s, this is not entirely uncommon. 1 out of 3, I believe, are the statistics for it. But hey, if you're 75, 80 years old, and this starts happening, it kind of supposed to start in your 50s, and it'll build up over time. And, you get old and you get stiffer, and this is one of the reasons. The other condition that causes dish, ankylosing spondylitis, which is what I've been saying that I have for the last several years. And my doctors have been arguing with me about this for the entire time. You don't have bamboo spine. You don't have the HLA whatever gene that you should have if you have it. You have rheumatoid or you have fibromyalgia or whatever. So obviously the big question is why, if the patient suspects that they have ankylosing spondylitis, why would you not do the diagnostics like, I don't know, an MRI of the middle back, the thoracic spine? Why would you not do that? They never did. I hear you, man. I don't know. What do? You have an option to get a scan. Sometimes you think, I don't know, maybe I don't really want to know how bad it is. I'll be honest, I thought, with the way I'm feeling, I probably have some sort of cancer going on. Maybe there's a cancerous tumor on my spine. But no, everything is supposedly cleared on that. The thing is, they didn't spot this. They just said I have degenerative spine. But I think the way this works is that on the back side, I really don't know that it does the same thing. Maybe it is. Yeah, it looks like it is there. Again, I'm not a doctor. I'm just learning all this. But they look kind of fusy there. See how they're good further down? And then you get up and it just starts blending. I've never had an x-ray. I've had an x-ray, but I've never had an MRI or a CT of my upper spine, of my back. I don't know why. But the point being, You know, I've complained about it for years. I've had middle back pain and all this, and no one has ever imaged it. My orthopedic surgeon that I go to, they've been mostly focused on my lower back pain. Um, I've mentioned it, and the last time I was there, they said, "Well, we could do an MRI of your upper back." I'm thinking, well, I mean, maybe if you think I should, and that was kind of where we left it at. So I'm rather disappointed. The point is, you've got to self-advocate. You know, if you just have it in your heart and mind that something's going on, it's probably going on, and you know, you just have to push. You have to push and push to get the right test, I guess. But I don't know. I wouldn't have known that. You know, I had no idea this stuff even really. I don't know. I don't even know. In any case, the question is, what about your SI joints? By the way, I didn't know what an SI joint was. It is the let me get the sacroiliac, I guess that's, or sacroiliac joint. I have a lot of pain in my I don't know my body parts very well, but I'll show you. These wings, like you call it like your hips, but it's really not your hip. I guess it's sort of your hips. I don't know. There's a name for these wings. And these things, man, sometimes they ache so bad. It's unbelievable. And your SI joints, your sacroiliac joints, are right here between the spine, basically, and these hip wings or hip bones. And if you have dish, these will be normal. Now, my problem is I don't have normal to look at and compare it to. But if you have ankylosing spondylitis, then you would expect to see likely weird bony outcroppings and fusion. So if you look at mine, you will see on the right side, looks like there's a space between that all the way around. Pretty much. And then if you look at, just ignore that ball right there, that's a bullet that's lodged in my leg. No, not really. I don't know what that is. Maybe my leg arteries are blocked off. Anyway, but if you look at this side, to me, this looks kind of fused in a way. I don't see the space. It looks fused. Also, I was informed recently at my physical therapist, you see these little outcroppings here? Like maybe it's starting to fuse as well. I was told that my right leg is longer than my left leg. So my theory is that if this is in fact fused, that it is pulling that leg up. It's kind of pulled it up and tightened up, closed up that gap. Whereas this side hasn't really done that yet. But I'm having a lot of, you know, pain in those bones up there, as well as my hips are really bothering me quite a bit as well. So I don't know. Hard to say. But just looking at this, I have made my diagnosis ankylosing spondylitis because this doesn't look right. Obviously, I'll need to get MRIs. I do have MRIs of my back, the lower part of it. I've got extensive MRIs of that. And I do have these two lower discs are drying out, and I've got bone-to-bone contact and inflammation of the bone and all kinds of stuff going on there as well. Basically, I'm a complete mess. To get back to the original idea of this video, which has now gone on for way too long, but I'm sure somebody is following along out there because they're dealing with these pains. You have to self-advocate, and that's all there is to it. I don't like not, I guess you could say not trusting is the word you could use. Doctors are busy. I think a lot of doctors are really good and they really care. I think some doctors don't care enough, or somewhere along the line they lost their way. That would describe my current rheumatologist, who I met 2 times in 3 years. I felt like I was a cow in a pen, you know. So you go in the waiting area, they call your name, you go back, see the nurse, checks a few of your vitals. You sit in a chair a few minutes, and then they'll bring you to a room, or they'll take you back to the IV thing to get your monthly dose or whatever. And they'll have you sit in the chair in the hallway. There's a long corridor, and the rooms come off the corridor, and then the IV clinic is down at the very end of that. So you see everybody in those chairs. You're just like sitting there, and I'm watching these people, and they're walking by, and they're like barely moving, barely, functioning with a cane or a walker or wheelchairs. And I'm like, man, the people aren't walking out of here. I'm walking in, and these people are not walking out. And I know it's not necessarily their fault because, these conditions they deal with, some of them are really brutal, and they're going to take people down. They're going to kill people. They're going to severely disable people, and they're seeing everybody. So you can't blame the doctor that somebody is handicapped or crippled. But still, I guess it'd be like if you're taking your car to a body shop, and every time you see a car leave, it's covered in dents and bad body work, and stuff is taped onto it. You start thinking I might be at the wrong body shop, and that was kind of that. And they had ran me all the way through the medications, DMARDs, whatever, and then biologics. And then they sat me in the office one day, and they said, well, we should go back to DMARDs. And I said, but they didn't work out for me at all. That's when I kind of started losing faith in them. And then they said, well, you just have fibromyalgia, which is, in my opinion, and please don't be offended if you have diagnosis of fibromyalgia, but the impression I got was this was something that they would give as a way of saying this person has got it more in their head than anything else, that they're hurting. That was kind of the feeling I got. In fact, I never went back. Because I told them I want to get off steroids. I've been hurting now for a long time. In my opinion, from at that time was the biologic made it happen. But I think in looking at the build up and the fusion of those bones, if that's what I'm seeing, that maybe it wasn't so much the biologic, but then maybe it was. There's a word, I can't think of it. Let me look this up real quick. Anyway, I don't know the word that it is, and I'll try to find it real quickly, but it's like you have pain. Let's say you have pain in this hand, and you take biologics, and now all of a sudden it's your shoulders are killing you, but your hand's better. The pain, the disease gets modified, I guess is one way of saying it, or it adapts to it, or it does something and it changes where it's actually affecting you at. That's probably the best way I can put it. It's not medically adequate, but and there's actually a word for it. So the biologics can change the conditions of the disease for the worse. 5% of people that get biologics experience that. They never told me that. Further, when I told them I was having changes like that, they ignored it and said it was no big deal. Suffice to say, I don't like that doctor, and I'm glad I stopped going. But given that I apparently do have ankylosing spondylitis or DISH, I do feel like I need to be under the care of a good rheumatologist. So I've been referred to one out of town, about 3 hours from here. But all the doctors are top rated. The practice is top rated, 4.9 on Google and other places. So I feel like I at least have a chance of being heard and properly diagnosed. Treatment wise, it's not really different. I mean, they put you on DMARDs, they'll put you on steroids, they'll put you on biologics, they'll put you on necrosis, tumor factor, whatever. I don't even know. These words are crazy. My body did not accept any of those things. It hated them. I felt sick in so many ways from everything that I tried. And I already feel miserable, so I'm not about to take something that's going to make me feel bad. Even if it's a means to an end, I can't do any worse. I don't want to be any worse than I feel already. Okay, so then your condition gets worse and now you feel worse all the time. Well, that's probably the case for me, Maybe a few years ago, had I gotten on something that actually helped, it would slow down what's going on and maybe I wouldn't be in as much pain. I don't know. Anyway, I don't recommend it. I'll show you guys a couple more cool things. So within this software from this CT scan, and again, I think I mentioned it earlier, but I'll tell you again in case you just got here. It's about $1,500 for the scan, and you can actually get your cardiac calcium score for free. They give you a low pressure sales pitch, on the full body scan, and by full body, it actually only goes from your neck down to your hips, basically. It doesn't take your arms or your legs, not for that price anyway. But we're looking at my lungs. I mean, how cool is that? That's really just wild. And they did find one little tiny thing in my lung, but they said it's pretty normal and small enough that they would not recommend any action on it. So that's good. But you can just get all kinds of different views. I mean, you can see your different organs, and there's all kinds of adjustments. You can see more or less of various organs, bones, skin. You can see the heart quite well here in between the lungs. But there's probably a way you could do transparencies as well. I'm pretty sure there is. But let's see, we can trim this down a little bit. I don't really know what all the different little passages in the lungs are and what they mean and what they do. But if you really look at this, I don't know that much medically speaking, but that right there is, if you look on the right side of the spine, that's the aorta. You can actually see it comes up, and you'll see here in a second it's round, and then it's making the U-turn, then it will turn and go back down and into the top of the heart. That's like your main vein if there ever was one. And then just kind of behind the aorta, between it and the spine, is your esophagus. Now, a funny little side story to that is this is not the best way to look at it. I'm not even sure what really is. Let's try this one here. I had a pretty good view on it the other day, but there's other views you can do as well. Let me see if I can set one up here. You can do, because this is basically putting all of the images together, but what you can do is, let's see if I get my bearings here. That's low. Okay. All right. So try not to get it too, because there are certain things you can see on here that I don't want to share to the world. But anyway, that round thing just above the spine, that is the aorta. There's also another tube, which is just next to that, which is kind of open. I believe that's the esophagus. What I want to show you about that is, I wish I could zoom in. I know there's a way to do it. What I want to show you about that is these protrusions. You see there's that protrusion on the spine, that bony bridge. It's actually pushing into the lung. But you'll see this esophagus runs along the spine there pretty much. We end up into the neck area here now. That's where the bones are starting to go more up. So what happens is these growths are actually pushing on your esophagus, and it can cause difficulty swallowing, which I have had in the past. It's probably not the I don't really know exactly that's what I'm seeing. I think because you got your airway as well, so if it splits, that's not it. You have your airway and you have your esophagus. I think the esophagus is actually the solid round small one that's between the open one and the big one right here. It runs right down along that spine. I can't quite get the view that I want here. And I'm just not entirely sure that's what I'm seeing, but in any case, these growths that are on the spine that protrude upwards are affecting your ability to swallow. And if they grow big enough, it can get where you can't swallow, and they've got to open you up and go in there and deal with it. So, not cool. Definitely not the coolest thing in the world to happen. This video is once again turned into like a super long experience. I'm just trying to convey a couple of things, and it's probably gone way beyond what. And that's cool. Looking at that's wild. So when I did the scan, you're clothed, and my zipper actually caused these rays because the point of origin of the x-ray source, and it actually was causing these rays in the image there. But the point I'm trying to make is please, please, please self-advocate every step of the way. Trust your doctors to the extent that you should, but always be mindful of the unfortunate reality of the situation, which is, there's money to be made, and certain doctors could be motivated to push certain treatments or medications on you, or maybe not do certain treatments or medications. I hate to have to put it that way. It sounds kind of bad. All I'm saying is trust but verify, and do your own research. People are, especially these days, doctors are very, very busy. They have a lot of patients. They don't have a lot of time to focus on any one particular patient. You are your primary doctor. You see your primary physician, once in a few months or something, but you see yourself every day. You should be your primary doctor. And if you're not feeling well, if you're having some kind of persistent issue, even if you're not, research it. This is a huge investment, probably the biggest investment you can make, because if you don't have good health, you don't got much. I was very fortunate. Other than this situation, I've had no problems until I reached about 50 and I had an appendix problem. But other than that, I just had some pain, no big deal. So my back hurts. But it actually turned out to be something quite a bit worse. And what I should have done, I was going to doctors quite a ways back with pain, and I was kind of being blown off in a lot of ways. And I just decided, well, if it's not a big deal to them, then it's not a big deal. But actually, it was a huge deal, unfortunately. So what I should have done is probably learn more about the causes and push for more different like outside of the box diagnostics. But I was busy. I was busy working and trying to make a living and trying to have a life and all that sort of thing. So, you can't really, you just can't stay on top of everything all the time. But I'm just telling you, as a person who is suffering from this situation right now, I would have definitely been better off had I gotten in front of a proper rheumatologist, and maybe had I pushed a little bit harder for certain things, particularly my middle back and the pains that I'm having there. I should have had diagnostic imagery of it sooner, because had I seen this 10 years ago, I probably would have pushed really hard to get on to some kind of medication that would stop it. Now, I can barely function, so, I get a couple hours, 2 or 3 hours a day I can do things, and the rest of the time I'm laid up, which, by the way, is not good for your cardiac health, not good for your good cholesterol, not good for your calcium deposit likelihood. So chances are I will suffer prematurely in terms of when I have a cardiac event because of my much more than I prefer sedentary type of lifestyle, if you will. And I've accepted that. I'm good with it. It is what it is. But if I can at least have someone out there watching my video get a wake up call, then if you've endured the nearly hour long discussion that I've had here. All right, well, I guess I'm going to clear out. I'll update you guys when I can, if I can. We will continue pressing on. Like I said, I'm going to be seeing a new rheumatologist here in a few weeks, I hope. And I don't know, maybe they know something the other one didn't, and they can, they know that this may help. Here, try this. You won't have any problems, and I'll take it, and I'll be fine. I still do believe in carnivore. I continue to practice the low carb lifestyle pretty significantly. My weight is staying where I want it. By no means am I planning to abandon it. However, should I get to a point where I'm just completely miserable all the time, and maybe I'm like gonna stroke out or have a heart attack anyway, then I'm gonna start going to the Waffle House and having my all-star breakfast, and I'm gonna start having more foods that I enjoy eating. I might be miserable in a lot of ways, but I'm not going to be miserable in how I'm eating. I'll put it that way. All right, well, I guess I will get out of here. So I will catch you guys on another